This is Dr. Vaishali and I am reading from the book Substance of Homeopathy, book written by Dr. Rajan Shankaran. Chapter number 15, The Separate State. There can be and usually a two or more miasm in a case. Though only one is prominent at a time, we can use an example of illustrate this. Consider a stramonium state where there is a hyper response of fear, sheer terror with clinging. This could be an acute miasm. However, why does such an intense state exist at all? It might have come from an intense situation, but also more commonly from the less intense situation in timid person. Thus, we find that the stramonium state comes up most easily in the calcarea type of the patient. A calcarea patient, when chased by a dog, would be like to develop a stramonium state, while platinum type of personality would take a stone and throw it at dog. Case is child age of 2 years, recurrent attack of cold, cough and fever, fear of stranger, animals, clinging to mother, grimacing. The stramonium venom was prescribed for her. Infrequent doses were given for several months. There was no more fever, but the recurrent cold remained same. Her fear of stranger and clinging decreased, and she stopped grimacing. However, her fear of animal remained, and she developed obstinacy and copious perspiration of the scalp. The remedy she now needs was calcarea carbonica. However, I have found that acute state can exist independently of other miasm even for a long time. I have seen in the practice that the acute remedy, purely the acute miasmatic expression with acute miasmatic expression like stramonium, belladonna and hyoscyamus have effected completely cure in chronic disease including reversible pathology. The reason, as already explained, is that though the condition is chronic, the perception of the condition and the expression thrown out are acute in nature. It is an acute state. For this reason, I have added the acute as the fourth miasm in the classification. A purely acute miasm would exist when the root is very strong of a very intense situation in a person in the past, or an intense situation creating the acute state in the mother during the pregnancy. Such occurrences are quite rare, and usually we find the psoric miasm represent in nearly all cases, with psychosis and syphilis becoming more and more common. It is seen that in a dominant psychotic state too, there is likely to be a psoric element. This is in keeping with our understanding of the miasm. Who is most likely to feel that something is lacking in him? It is one who has struggled to cope with the external situation and failed. He will then feel that something is wrong with him and try to cover it up. This perceives the weakness. Similarly, in a predominant syphilitic state, there are likely to be both psoric and psychotic element. This helps us to understand why Hahnemann called Sura the mother of all diseases. It is the most likely of all the miasm to be present alone, and is nearly always present when there are other miasm. At any particular time in a case, the state of the patient is usually never purely psoric or purely acute, etc. The main focus of the symptomatology will be on one miasm, but there will be a glimpse of symptoms showing the other miasm too. This is easy to understand if we analyze person's reaction when faced with the situation. For example, the situation of the burst tire at the loud bang, the person is bound to get out quickly and be startled, then think, okay, let me try to change the tire, though I have never done it before, and then if I can't do it, I will call someone. Finally, he feels I can't do it and there is no one to help and I give up. However, depending on which miasm is prominent, that reaction will be intense and persistent. Where the acute miasm is prominent, the person will continue to look stutter with the blanched face and palpitation long after he gets out of the car and realize that it is only the burst tire. Other reactions and thought may come and go, but the startled expressions and fear will persist for a long. Such a state could be diagrammatically represented as the top of the diagram pillar. The first is acute, second step is sora, then psychosis, and then syphilis. Means acute has a 4 grade, sora has a 3 grade, psychosis has a 2 grade, and syphilis has a 1 grade. The remedy that we give for the predominant acute state must also cover the reaction from the other miasm. In given case, where 2 or more miasms are found to be prominent, the remedy must cover the most prominent miasm as well as the other. As the stage change, it may be found that the different miasm shows the predominance. The following diagram of the same patient's progression in case is illustrative. We see that the entire diagram illustrations one state where syphilis is prominent but other are present as well. Means in other state, the syphilis on the top, the sora, then acute, and then psychosis. The drug may be mercurius, aurum metallicum and palladium. After being treated by the indicated drug for a long time, usually years for treatment, the state may change with the predominance of the psychosis. Means the on the pillar of diagram, psychosis on the top, then syphilis, then acute, and then sora. It is the mention in homeopathic literature that sulfur, calcium, and lycopodium follow each other. They are often indicated in this sequence. All are soric remedy with other miasmatic dimensions. The following is a diagrammatically represent of the case where such a sequence occur, where in sulfur the sora is on the top, and in calcarea sora is on the top, and lycopodium sora is the top. But psychosis has a more deeper grade, has a 3rd grade, while in sulfur psychosis is less prominent. In calcarea psychosis is more prominent, and lycopodium it is more than calcarea and less than sulfur. Acute, as exactly the sulfur has a acute state in a prominent state, while in calcarea less. In lycopodium it is as above the sulfur, and syphilitic is more in the lycopodium and sulfur than calcarea. And psychotic is already mentioned that sulfur has a more grade, and calcarea has a more grade, and sulfur has a less grade, and lycopodium has a very less grade. We find that in this soric remedy, sulfur has the greatest element of sora. Calcarea has a marked psychotic element too, while lycopodium is most syphilitic amongst these 3 soric remedy. In fact, I believe lycopodium is the most syphilitic of all type of soric medicines. The cyclical sequence that actually represents the treatment of the predominant sora state with the various phase showing a relatively prominence of the sora, psychosis, and syphilis. I would like to stress once again that these changes take place over a large time scale, and the indication for the respective drug are very clear cut. I find it necessary to bring this point to the notice because I have seen a rapid alternation of the remedy by many beginners, and with a change of miasm being offered as a reason.